really great to see everyone. I hope you're having a very happy Tuesday. I just wanted to first introduce Jack here, who we're going to have facilitate this conversation. He's prepared a few slides on the topic. We're going real far-reaching with this, so I can't wait to begin to brush the surface. But Jack is a veterinary IT expert and certified ethical hacker. Jack has worked alongside the veterinary sector since he set up his first business, age 16. He's made it his mission to help veterinary practices across the UK utilize their technology so that they can function in a secure, professional, and efficient manner, leaving vets to focus on patient care, a surprising thing in this day and age. Vets focusing in on one thing. That's kind of our goal at Celeritas too, is to support veterinarians and animal health. So what I like to do every month when we have these conversations is go out and find someone who has a passion project or topic that they can talk about for maybe not only an hour, but longer. But we find what that topic is. We look into it and we hold a conversation around it every month with a new person or maybe a repeat person. And the main goal is to share ideas and to learn and to figure out ways to support people in the animal health industry, the veterinary industry, even the pharmaceutical industry. And with Celeritas specifically, we're helping with technology solutions. And I just want to read the chat right now because we have some new introductions and I don't want to gloss over them. So we have Joanna saying, "Hi everyone, my name is Joanna from Portugal and currently working at a small animal practice. Obrigado, Joanna. It's very nice to meet you. Hi all. David Brown here, based in the UK and acting as a consultant to the pharma industry on all things commercial and marketing. I think we as an industry have been slow adopters, so interested to learn more." It's an interesting point. I think we have a lot to talk about, so I want to kind of pass the mic off to Jack and get started on this thing. But thank you everyone for joining today.
Cool. Thanks, Daniel. Are you able to give me sharing access?
Absolutely.
Thank you very much.
Okay, there we go.
Awesome. Right. Okay. So hopefully, make sure I share the sound. Let me know when you can see my screen.
Yeah, got it.
Cool. Awesome. All right. Well, firstly, a massive thank you to Daniel and the team at Celeritas for having me to speak about the topic that I'm particularly passionate about, which is artificial intelligence. Now, as the title suggests, my aim is to tackle a topic in a short period of time and give you an authentic view on what AI is, looking at its various types of real world applications, and then looking at the challenges and maybe some of the ethical considerations. Now, as we delve into this fascinating subject, I encourage you to keep an open mind and actively participate in the discussion. So let's get started. Now, before we do get stuck in, the world around us has changed. The fact is we're still playing catch up. So our clients, especially in the veterinary profession, have evolved, or at least their expectations of how they work with us have. Gen Z and millennials represent around 70% of pet owners. They see their pet as their child. They value time-saving technology and technological interfaces that respond quickly to their needs. They enjoy learning and being prepared. Their convenience is very important to them. They want to collaborate with companies that share their beliefs, such as things like sustainability. They desire openness, such as upfront cost estimates. However, it doesn't stop there, since everyone else has adapted too. Most have had no choice but to utilize technology day to day since COVID, but have then continued to embrace it. Therefore, expectations towards their service providers have increased. Where we thought we were safe in our practices during COVID, not having to deal with the clients, they've actually been multiplying. Well, the animals have, that is. So we have clients that expect more of us, and there are more of them. In fact, half of all UK households now own a pet. The sad factor is, however, is that a selection of these new pet owners are ill-educated and poorly prepared for the new companion, putting even more added pressure on you and your teams. Now, I mentioned that as an industry, we're playing catch up, and that is no understatement. Our ineffective utilization of our teams and technology lead to a host of inefficiencies, leading to even more pressure being added on the teams. Our technology in most cases does not enable us, in fact, it impedes us. I mean it when I say, as a profession, we're at least 10 years behind. We're not supported. In fact, we're impeded and smothered for choice. Would it surprise you if I said we had 62 different PMS solutions within the marketplace? Well, at least what I could find. Last time I checked, you guys were not tech gurus, you're animal experts. So does this choice overwhelm and intimidate? Talking about intimidation, I feel sorry for new graduates that are coming into this world of veterinary. They're ill prepared. I mean, how can you prepare them for a business model that just isn't working? Oh, and let's add corporatization into the mix too. All the above lead to longer hours, constant fear of making a mistake, and an endless list of administrative and clerical tasks, which is ultimately taking you away from what you do best, being a veterinary professional. One of the biggest challenges this leads to is retention. Whether this is through them leaving for another profession, I know, how can that be the best option? Or in worst case, the topic that is the elephant in the room, mental health. It's a vicious circle because guess what? Retention issues in a growing market just leads to even more pressure. The fact is, it's a bleak picture, one which is hard to see through, but ultimately it doesn't have to be bleak. The fact is there are solutions out there to help tackle some of these problems, one of which is artificial intelligence. No, this doesn't solve everything, but one thing it can alleviate is the pressure from our teams, provide a greater client experience, as well as help improve patient care, which is the ultimate reason why you're all in this profession. Okay, so quite an intense start. Let's bring it back. And I'm going to give you a bit of background on myself. So my name's Jack Peplow. Now, I always like to give audience a chance to get to know me when presenting. So before I get started, here are a few fun facts about me. I'm a veterinary IT professional and also, as well as being a certified ethical hacker, a good guy who is passionate about helping those in the veterinary field continue to good by helping our furry friends. Now, I do thrive on interaction, so I have one of these very familiar QR codes on the bottom right of the screen. Can I ask when you get a second, if you can get involved very quickly to scan this? And when you get it, yes, I know as I'm a hacker, asking you to scan something is clearly going to be something dodgy. Well, as I said, I'm an ethical one, and I promise, therefore, there is nothing dodgy about this QR code. Now, finally, I love dressing comfortably, and I am so glad this meeting is virtual because I didn't have to iron my trousers, as you're only going to see my top half. Mind you, it did cross my mind about wearing my beach shorts, but then thought I might get a bit overexcited while presenting and accidentally jump up, so I didn't. Anyway, enough about me. Let's get into the real reason why I'm speaking with you today. I've felt so far that no one within the veterinary profession has yet provided a presentation that provides a clear understanding of what AI is, as well as providing some creativity on what it can and will do. Now, caveat, I am no means a data scientist, but I do work with veterinary practices worldwide to help strategically with their technology to help achieve three things: increase efficiency, improve staff well-being, and boost profits. For me to achieve this, I have to understand the current and future capabilities of technology. So let's get stuck in. A quick question for you all. You can either fill in this form or via the QR code, or just answer out, just be interested. Who's currently using AI? And I know obviously there are a number of you that aren't in practice, but who's actually currently using it?
No.
No?
I'm currently building solutions for veterinary surgeons to use. So
excellent. I'll run with that one, Lee. And I'm not surprised considering your background, but that's very exciting. I want to know more, so I'm gonna have to catch up with you afterwards. But that's very cool. Okay, so we got a bit of a 50-50 split, probably a little bit more than that. So I'm going to start with the basics because, like I say, we've got people of very different levels here, which is absolutely fine. Key question for me is, and for maybe you guys, is what is AI or artificial intelligence? Well, AI refers to the ability of machines to perform tasks that typically require human intelligence. In other words, AI enables machines to learn from experience, adapt to new situations, and make decisions based on data analysis. Now, AI has become increasingly important in today's world as it can help us solve complex problems, automate tedious tasks, and improve efficiency. To put it simply, AI is like having a digital brain that can process vast amounts of information and make decisions based on that data. Some examples of AI in our daily lives include things like virtual assistants like Siri and Alexa, personalized recommendations on Netflix and Amazon, and things like self-driving cars. So we have a basic understanding of what AI is. Let's now explore the different types of AI that are relevant to the veterinary profession. Now, understanding these types will give us insights into how AI technologies work and their applications in our field. So first up, we have machine learning. Now, machine learning is a subset of AI that focuses on enabling machines to learn and make predictions or decisions without being explicitly programmed. It involves training algorithms on large data sets to recognize patterns and make informed decisions based on the input data. In veterinary practice, machine learning algorithms can analyze medical images such as X-rays or ultrasounds to assist in the diagnosis or detect abnormalities. Now, it can also aid in treatment planning by providing personalized recommendations based on patient-specific data and medical records. Next up, we have deep learning. Now, deep learning is a subfield of machine learning that mimics the structure and functionality of the human brain through artificial neural networks. A lot of big words here, guys, so I do apologize. Deep learning algorithms learn from vast amounts of data, extracting hierarchical representations of features to solve complex problems. Now, again, in the veterinary profession, deep learning has shown promising results in image recognition tasks, such as identifying specific diseases or anomalies in medical images. For example, deep learning models can accurately classify skin conditions in animals or detect tumors in radiographic images. The final area is neural networks. Now, neural networks are the foundations of both machine learning and deep learning. These networks consist of interconnected artificial neurons that process and transmit information. Now, by simulating the behavior of biological neurons, neural networks can learn and perform complex computations. Now, again, in the veterinary field, neural networks are employed in various applications, including natural language processing for analyzing veterinary literature or clinical notes, or in predictive modeling for identifying potential health risks or disease progression in animals. Now, it's important to note that while machine learning, deep learning, and neural networks are distinct types of AI, they often work together synergistically. Now, with neural networks serving as the backbone of deep learning algorithms. Now, understanding these different types of AI allows veterinary professionals to appreciate the underlying technologies driving AI enhancements and better utilize AI-based tools in their practice. Now, by harnessing the power of machine learning, deep learning, and neural networks, we can enhance diagnostics, treatment planning, and overall patient care. So let's explore some real-world examples of how AI is transforming the veterinary profession. Now, AI has a rich history that has spanned many decades, and its ongoing development continues to shape various aspects of our lives today. If you're not using it, you should now look to how you can embrace it, as it's more accessible than ever. Now, you can use it for things like creating a presentation for, say, for example, your next partners meeting. You could even use it, for example, generating a job post or even generating content for your next marketing campaign to push your pet grooming products. Maybe it's doing a refresh of your website. You could even create a digital avatar. And this is a very, very poor example, but one that was thrown together within literally 30 seconds. You can actually synthesize your voice and use this for an easy way to create, for example, staff or client training material without always having to stand in front of a camera. The fact is, this is just barely scrapes the surface. However, it is an example of just some of the more accessible AI. So back to you guys. What, for people that are sort of playing in the AI field or playing with it, what area excites you the most?
Well, I can start that off, Jack, just because something you mentioned in passing is about the goal to use AI in tandem with becoming a diagnostic tool for veterinarians. I'm really excited to see the day when that's continued to be improved upon.
Yes.
I think that we're headed in a good direction with that. So that's kind of what's got me the most excited.
Yeah, absolutely. Personal assistant's a very good one. I know that there are quite a number of tasks that I actually utilize AI for on a day-by-day basis, whether that's for scheduling my diary, whether that's for kind of creating inspiration for content. So even things like building, for example, a presentation, or even, for example, building a blog. There's a whole host of things that you can use it for. Client communication is another great one. Obviously, there's a bit of a gray area with regards to the types of correspondence that you can make, especially if you're providing advice. However, it can also take away those really kind of boring and dull tasks. I like to say automating the mundane, because I think that's very, very relevant. But, you know, for example, if you are about to have a telehealth or telemedicine meeting, so a consultation over video, actually getting the client prepared and ready so that they're ready for the vet or the vet nurse before they actually turn up, so we're wasting less time. So there's lots and lots of areas that you can potentially utilize. I can see someone else is typing, so I'm just going to hold off and let them finish. Nope. Okay. Oh no, we're still going. I'm really looking forward to this one. Okay, predict buying behavior. Absolutely. I mean, with the amount of data that's out there, there's lots of things that you can do. Ultimately, AI is driven off that data. So being able to actually have a decent data set, which is something we're going to talk about a little bit later, would allow us to actually make some very informed choices and be able to better understand the types of clients that we're dealing with and when and what they're going to buy, which is very exciting. So yeah, some really good points there, guys. So thank you. So there is so much scope with AI, and it is a bit of a vast subject, but what I wanted to do is pick on just a couple of areas and show you what AI can do. And for this, we're going to cover the areas such as conversational based, predictive care, detection and prevention, surgical, and drug discovery and development. So starting with predictive care, in our quest to improve overall patient care and provide animals with happier, healthier lives, AI has the potential to revolutionize how we understand our animals. One exciting avenue is the use of wearables such as IoT devices in conjunction with AI technologies. Now, let's explore how these technologies can help us gain valuable insights and better communicate with our animal companions. First up, we have flagging potential anomalies. Now, wearables equipped with sensors can collect a wealth of data about an animal's behavior, movement, and vital signs. Through AI-powered analysis, these devices flag potential anomalies that may not be immediately apparent to the human eye. By continuously monitoring an animal's health and behavior, wearables can detect subtle changes that might indicate underlying issues or potential risks. This early detection allows both the animal owner and veterinary professional to intervene promptly and provide necessary care. Now, a good example of this is the Pet Insight project, where Whistle, a leading pet wearable manufacturer who is working with other firms on the development of FilterNet, a machine learning architecture that translates data from a Whistle wearable device into specific canine behaviors like licking, scratching, and eating. Moreover, AI systems can process and analyze mass amounts of data collected from multiple animals, enabling them to identify trends and patterns. Now, this capability helps in predicting and anticipating potential health issues, providing insights that were previously inaccessible through traditional methods. We then have better communication with the animals. So we've spoken about obviously communicating with people, but actually let's look at communication with animals. AI combined with data collected through wearables can help us better understand and communicate with our animals. By analyzing behavioral patterns, AI systems can identify unique cues and signals that animals exhibit. This insight enables us to comprehend their needs, emotions, and potential sources of discomfort more effectively. For example, AI algorithms can analyze data from wearables to recognize subtle changes in an animal's movement or behavior, indicating pain or discomfort. By interpreting this data, we can develop targeted treatment plans and provide more personalized care. Additionally, AI can help decipher non-verbal communication cues, such as body language or vocalizations, through machine learning techniques. Now, this understanding fosters improved communication between veterinary professionals, animal owners, and the animals themselves, enabling a deeper level of care and understanding. Another area here, and the final area in this particular section, is improving the overall profession. So the data collected by AI wearables for animals holds immense research potential. So aggregated and anonymized data from a large number of pets can contribute to the identification of population-level health trends. Researchers can then leverage this data to develop new therapies, improve veterinary practices, and gain a deeper understanding of animal health. The insights gained through data-driven research will propel veterinary medicine forward, benefiting both animals and humans. Overall, the integration of AI and wearables in understanding animals offers immense potential to improve overall patient care and provide animals with happier, healthier lives. By leveraging AI technologies to flag potential anomalies and better communicate with our animals, we can enhance early intervention, tailor treatment plans, and provide a higher quality of care. The big takeaway is this is just literally scraping the surface on what could be achieved. Now, the next area I wanted to talk about is conversational AI. We all have probably come across one form or another, most popular being Alexa and Siri. Conversational AI comes in many forms, such as I actually have a good video example for you, which was of Google Duplex. Now, this is where AI was tasked to book a table for 4 people at a Chinese restaurant. And what's interesting about this is actually showcased back in 2018, so over 5 years ago.
See, how may I help you?
Hi, I'd like to reserve a table for Wednesday the 7th.
For 7 people?
It's for 4 people.
4 people when? Today?
Next
Tonight?
Wednesday at 6 p.m.
Oh, actually we reserve for like after like 5 people. For 4 people you can come.
How long is the wait usually to be seated?
For when, tomorrow or weekday or?
For next Wednesday, the 7th.
Oh no, it's not too busy. You can come for 4 people, okay?
Oh, I gotcha. Thanks.
Bye bye.
Talk about making it super challenging, but heck. Conversational AI has the potential to revolutionize the way veterinary professionals interact with clients, provide information, and deliver veterinary care. Now, by utilizing conversational AI technologies, veterinary practices can enhance communication, improve efficiency, and deliver personalized care. Now, this can come in many different forms, one of which is virtual assistants and chatbots. Now, virtual assistants and chatbots powered by AI can provide instant responses to common queries, appointment scheduling, and basic pet care information. They can handle routine tasks, freeing up veterinary professionals' time to focus on more complex cases and providing personalized care. Another area is telemedicine and remote consultations. So conversational AI enables telemedicine capabilities, allowing veterinarians to remotely assess and diagnose certain conditions through video consultations. Now, that teamed with AI-powered chatbots can assist in gathering initial information and guide clients through the necessary steps for remote consultations, enhancing accessibility and convenience. Another area here is symptom triage and advice. Again, conversational AI systems can engage in interactive conversations with pet owners to gather information about symptoms and provide initial triage and advice. Now, based on information gathered, AI algorithms can offer recommendations on whether immediate veterinary attention is required or provide guidance for home care. A good example of a tool that utilizes AI for symptom checking is Joy. Another area is decision support and reference tools. Now, AI-powered conversational systems can serve as a decision support tool for veterinary professionals, providing access to a vast database of medical knowledge and treatment protocols. Now, veterinarians can interact with these systems to obtain real-time information, evidence-based recommendations, and treatment guidelines, enhancing clinical decision-making. And then finally, we've got follow-up and remote monitoring. So conversational AI can automate follow-up communications, sending reminders for medication administration, post-operative care instructions, and schedule follow-up appointments. Now, remote monitoring devices integrated with conversational AI systems can collect and analyze data on vital signs or behavior, enabling proactive care management. The takeaway here is conversational AI technologies offer valuable tools for veterinary professionals, enhancing communication, improving accessibility, and providing personalized care. Now, virtual assistants, telemedicine capabilities, symptom triage, decision support, and remote monitoring are just a few ways conversational AI can be utilized in veterinary practice. Now, embracing conversational AI can streamline workflows, improve client satisfaction, and enhance the overall quality of care in veterinary practice. So another area I wanted to quickly talk about was detection and prevention. Now, again, in the field of veterinary medicine, the role of AI in detection and prevention is becoming increasingly significant. So AI technologies offer valuable tools and insights that can enhance our ability to identify and prevent disease in animals. Let's again explore the prospects of how AI can assist veterinary professionals in these crucial areas. So first up, we have early disease detection. So AI algorithms can analyze large volumes of data, including medical records, lab results, and diagnostic images, to identify subtle patterns and indicators of diseases at their early stages. By leveraging machine learning and deep learning techniques, AI can provide veterinary professionals with valuable assistance in recognizing early warning signs that may go unnoticed by the human eye. Early disease detection facilitates prompt intervention and treatment, increasing the chances of successful outcomes and improving animal welfare. We then have predictive analytics. Now, AI systems can leverage historical data and machine learning algorithms to predict the likelihood of certain diseases or health conditions in animals. By analyzing patterns and trends, these systems can generate predictive models that help veterinary professionals anticipate potential risks and take preventative measures. For example, AI can analyze factors such as breed, age, genetics, and environmental factors to estimate the probability of specific diseases occurring. Now, this knowledge enables veterinarians to implement proactive strategies such as targeted vaccination campaigns or preventative treatments to safeguard animal health. Another area is monitoring outbreaks and epidemiology. Now, AI-powered tools can assist in monitoring and analyzing data related to disease outbreaks and epidemiological, sorry, I can't even spit the words out, trends in animal populations. Now, by aggregating and analyzing data from various sources, including veterinary clinics, animal health databases, and even social media, AI can identify patterns and early warning signs of potential outbreaks. Now, this information is invaluable in implementing timely preventative measures such as targeted surveillance, vaccination campaigns, or biosecurity protocols. Now, AI-driven monitoring and analysis enhance our ability to respond swiftly to emerging diseases and prevent their spread. And then the final area here is decision support systems. So AI can empower veterinary professionals with decision support systems that provide evidence-based recommendations and guidance. Now, by combining AI algorithms with clinical expertise, these systems can assist in diagnostic decision-making, treatment planning, and medication selection. So AI-based decision support systems leverage vast amounts of data and research to offer veterinarians a comprehensive understanding of different treatment options, potential risks, and expected outcomes. This technology promotes more accurate diagnosis and treatment plans, ultimately improving patient care. Now, the integration of AI in detection and prevention has the potential to revolutionize veterinary practice. By leveraging AI's analytical capabilities, predictive power, and decision support systems, we can enhance our ability to identify diseases early, predict risks, monitor outbreaks, and make well-informed treatment decisions. AI is an invaluable partner in our mission to provide the highest standard of care and improve animal health and well-being. Now, another area I want to talk about is the surgical side of things. So AI is transforming the field of veterinary surgery, enhancing precision, efficiency, and patient outcomes. Now, by leveraging these technologies, veterinarians can access advanced tools and capabilities that revolutionize surgical procedures. And that could be from everything from preoperative planning and imaging. So AI algorithms can analyze diagnostic images such as X-rays or MRIs to assist with preoperative planning. Now, by identifying anatomical structures, abnormalities, and potential risks, AI helps veterinarians develop personalized surgical strategies and optimize patient outcomes. Solutions include things like VetCT and Signal PET, to name but a few. Another area is surgical robotics and assistance. So AI-powered surgical robots can perform intricate procedures with high precision and dexterity. These robots, guided by AI algorithms, augment the skills of veterinary surgeons, reducing human error and enabling minimally invasive surgeries. Solutions again include things like VetBot. We then have real-time surgical guidance. So AI can provide real-time guidance during surgeries, helping veterinarians navigate complex anatomical structures and avoid critical areas. With AI-assisted visualization and feedback systems, surgeons can make more informed decisions, leading to improved surgical precision and safety. We then have predictive analytics and risk assessment. So AI algorithms can analyze patient data, including medical records, vital signs, and genetic information to assess surgical risks and predict potential complications. Now, this enables veterinarians to tailor surgical plans, optimize anesthesia protocols, and minimize post-operative risks, enhancing overall patient safety. And then finally, we've got post-operative monitoring and recovery. So AI-based monitoring systems can track patients' vital signs, pain levels, and recovery progress post-surgery. Now, by continuously analyzing data and alerting veterinarians to any concerning changes, AI facilitates early intervention, accelerates recovery, and reduces complications. We're nearly there, guys. The final area I wanted to talk about is the drug discovery and development side of things. So veterinary drug discovery plays a vital role in improving animal health and well-being. Now, the traditional drug discovery process can be time-consuming and costly, often taking several years to bring a new drug to market. Now, AI is revolutionizing the drug discovery process, accelerating the development of targeted treatments for veterinary care. How? Because by harnessing the power of AI in drug discovery, AI algorithms and machine learning techniques can analyze vast amounts of data more quickly and accurately than traditional methods. Now, by processing data from diverse sources such as genetic information, clinical records, and scientific literature, AI can uncover invaluable insights and patterns. We then have targeted identification and validation. So AI algorithms help identify potential drug targets by analyzing complex biological networks and molecular interactions. Through computational simulations, AI can predict the efficacy and safety of drug candidates, enabling targeted treatments with fewer side effects. We then have higher throughput screening. AI-driven automation enables high throughput screening of large compound libraries, significantly increasing the speed of identifying potential drug candidates. Now, by rapidly analyzing molecular structures and their interactions, AI algorithms can prioritize the most promising compounds for further investigation. We then have predictive modeling and optimization. So AI algorithms can simulate and predict drug behavior in various scenarios, reducing the need for extensive laboratory testing. This predictive modeling allows researchers to optimize drug formulations, dosage, and delivery methods for enhanced efficacy and reduced toxicity. And finally, we've got repurposing existing drugs. So AI can identify potential new applications for existing drugs by analyzing vast databases and uncovering connections between different diseases and treatments. This approach of repurposing drugs not only saves time and resources, but also brings new treatment options to veterinary professionals faster. Now, there are many, many organizations that are actually looking at utilizing and using AI within the drug discovery process. And to name just a few, you've got things like Animal Health Trust and In Silico Medicine. So just quickly back to you guys, what kind of, because I want to quickly talk about concerns, what are your biggest concerns with AI? I know one was going to be GDPR. Or general compliance, I should say.
I was just about to type GDPR, Jane.
I've got the right person in the room. Implementation is a really good one.
Yeah.
Obviously, the big thing with implementing AI, and this can come from many different forms, is first of all, it's whether it's an accessible technology, and I suppose you've got the integration there, because a lot of the hard work should be done by the vendors. Ultimately, it's not your job to create these new solutions. I mean, we've worked on solutions ourselves where we're trying to utilize AI engines to streamline and make ourselves more efficient, but we're actually building these ourselves. While it's actually better if you can get solutions off the shelf, but obviously it's a big move to integrate them. Lack of regulation is a very, very good point. And obviously that comes into the fact of, and it's something which I'm going to talk about, is the black box fear of actually not fully understanding how these solutions are coming to the decisions that they have, and the fact that obviously there is no one controlling this. Cost. Doesn't always have to be that expensive. Talking about very, very basic solutions, there are so many cost-effective solutions. I appreciate when you start going into the field of, very specialist solutions, they can be extremely expensive. But I mean, again, I'd be interested if anyone's really played around with ChatGPT. There are lots of others out there, Bardo, etc. But ultimately, these solutions are like so inexpensive. I was having a jokey conversation with my hairdresser the other day. And while having a haircut, he was sort of fretting because he had to go and spend a lot of money on getting some models in to sort of show off different haircuts. And I mentioned the idea of utilizing something like Midjourney, which is an image generator. He's actually gone and done that and saved himself thousands. I think it ended up costing him £25. Black box, what's there? No one knows. Cool. All right. So let's just play that.
Playing jazz.
Playing jazz.
Smoothie.
Making smoothie.
Calendar.
No meetings today. Remember, dentist at 9:30.
Fire off.
Fire off.
Open door.
Door open.
And we're gonna do one more.
Oh yeah. Open door.
Wrong voice command.
Open door.
Wrong voice command.
Open door.
Repeat that.
Open door.
I didn't understand that.
Hey, open door.
Play on the floor.
Get over the floor. Open the door.
Wrong
Open the
voice
door.
command. Error.
Hey there. With a rock. Open door. Open door. Higher.
Higher volume.
Higher.
That's natural language processing, not its best. As the video depicts, there is still a long way to go to perfecting the technology. Firstly, the availability and quality of data poses a challenge, as AI systems require large volumes of diverse and high quality data for accurate predictions. Now, accessing comprehensive data sets specific to animal health can be a hurdle that needs to be overcome. Then we've got the interpretability and transparency of AI algorithms present another challenge. AI models, especially deep learning neural networks, can operate as I said earlier, a black box, making it difficult to understand and interpret their decision-making process. Ensuring interpretability and building trust in AI systems among veterinary professionals is crucial for their acceptance and widespread use. And then we have the ethical and legal considerations. These also need to be addressed in AI. Now, questions of responsibility and liability arise when AI systems make decisions, and frameworks must be established to ensure compliance with ethical standards and privacy regulations. Additionally, integrating AI into existing veterinary workflows and continuously updating and improving AI models pose ongoing challenges that require collaboration and adaptation. So the final thing I want to leave with you is the integration of AI in veterinary practice heralds a transformative era, empowering veterinary professionals to revolutionize animal healthcare and well-being. With AI's capabilities, diagnostics and treatments will reach new heights, enabling accurate disease detection, personalized medicine, and improved treatment outcomes. Now, streamlined workflows and automation will enhance efficiency, allowing veterinarians to dedicate more time to patient care. Proactive and preventative care will become the norm as AI-driven monitoring and predictive analytics identify health risks, leading to early intervention and better disease management. Collaborative research and data sharing will accelerate advancements in veterinary medicine, fostering innovation and expanding our understanding of animal health and diseases. Now, embracing AI in veterinary practice will create a future where animals receive the highest standards of care enabled by cutting-edge technologies and continuous innovation. And thank you very much, guys.
Wow, thank you, Jack. That was great. And I think one thing is we skipped over an anonymous message in the Q&A section.
Apologies.
And I want to read this out just because I think that this is interesting. And we did kind of brush over it, but ethics and the fact that ultimately we don't know how AI resolves the problems. We don't have access to the black box. That's what someone wrote in the Q&A section for concerns about AI. And so I think that was an interesting thing to mention.
Yeah, absolutely, 100%. I mean, it's going to be a difficult one because we're still very much exploring the technologies. I mean, AI has been around for, a long time now, and we're still very much dabbling and playing with it, understanding its capabilities. And at the end of the day, it's like with most things within technology, it is trying to implement some form of basic standards. And, sometimes we're not particularly good at that. I mean, if we take, for example, the veterinary profession as a whole, we haven't really got a technological standard, and that's something that you would expect to be even the most fundamental and basic thing. If you look at the RCVS standards and the Royal College standards, at the end of it, within the UK, there is no mention of anything relating to digital. Even though this was something, and Lee, I'm sure you probably agree with this one, especially considering you've been in the PMS field. But there've been examples where I've seen practice management systems where they don't even have the basic practices in place to ensure that their clients' data is safe. And again, that's because there are no safeguards, there's no kind of standard. So I don't know honestly how that's going to be addressed. It needs to be, it absolutely needs to be, because obviously this is something that could go out of control very, very quickly. And that's where we need to sort of take, I suppose, baby steps, try to understand the power and the capabilities of what we can do, but sort of take it step by step.
And yeah, you mentioned Lee, I want to learn more about what you're doing with PMS.
Yeah. Well, I was just going to comment on your black box. I think we will not get away from the black box solution. So I've worked with black box solutions with sexing technologies on sex semen. You're not going to get to know how they do it.
No.
That's their IP. It's in the black box. It's staying in the black box. You put in semen at one end and you get sexed semen, male semen, female out the other side. So you're not going to get to know what's in that particular black box AI solution.
No, I completely agree.
And how do you end up solving the issue of data protection as everything continues to evolve, Lee? what do you think the way to stay on top of that?
What data are you looking to protect? Personally identifiable data, or just because data is data? You know, it's like what are you looking to protect?
That's a good point. I mean, I wonder how as things progress and to every side of the coin where there are the ethical hackers, when there's unethical hackers and agent AI that like can whose capabilities are beyond what we can imagine right now. How do we protect against that or foresee protective measures that we can take with things like PIM systems?
Yeah, from a PMS perspective, yeah, especially as they're moving more and more cloud-based. So when I first started with PMSs, they were all farm practices that were buying PMSs because they needed a way of generating bills. The systems were all on-premise, the backups were all on-premise. They were rock solid. You know, it was a 1200 bits per second modem was your remote access for fixing problems. So it's, you know, the evolution of the PMS has made it more vulnerable. I don't think the Royal College will get involved at all with the safety and the security of that data, because that should be down to the PMS suppliers. They're a business in industry, may not only be in the veterinary industry. I think of a couple of other PMS suppliers. They are, you know, they should employ basic standard security.
Yeah. I think Web3 is going to be quite interesting, and data ownership, because obviously data ownership is changing, and I'm intrigued to see how that's going to happen. I mean, there are a number of, and I know we're going off on a bit of a tangent here, but just in relation to the data security side of things, you know, there are a number of organizations that are starting to utilize things like the blockchain. So it's kind of not having a single source for the data and a single partner that's responsible for that data, which is quite interesting, and actually having situations where, you know, because I think eventually, and this is my personal opinion, and again, this isn't really where AI comes in, but I believe we're eventually going to get to a point where we have a completely mobile health record, and actually the PMS is going to almost turn into almost like an appointment scheduler, and a solution that integrates the different solutions out there. So whether it be like the imaging platforms or your labs or whatever it might be, but actually all the health records would go onto a source, like for example blockchain. And when you visit the practice, and it's a bit extreme, but you know, you go to the practice and you bring your animal in, it scans the microchip, and the immediate request for consent to the data is presented to the client in question for them to give it access to that particular client. And that doesn't address the issue of data security, but it's just a different approach to what we need to protect.
Yeah, that reminds me a little bit of the XML that I worked on when I had a lot less grey hair. The free flowing of data, but some of that was a bit like turkeys voting for Christmas, so it didn't.
Well, especially from what I've seen.
But yeah, I agree with you a little bit about the blockchain. I'm currently building a solution using NFTs,
cool.
just to unique identifier, more for provenance and progeny. So yeah, it's definitely, the blockchain is definitely underused in the veterinary, but I think it should just be invisible to the veterinary surgeon and the veterinary industry. It should just be behind the scenes.
Yeah. They don't need to worry about that. Really,
it's a sales spiel that
from a GDPR perspective, I agree with what Lee said. It is up to the PMS when they're developing the solution to ensure that, you know, there is data security, and really they should be applying data protection by design as they are designing the application, the software. But I think the responsibility also sits with the veterinary practice themselves, 100%. That prior to choosing a PMS, they should do their proper due diligence. So 100%. The responsibility is on both, which will then force the developers of PMS to really apply data protection by design in their design. So it kind of, you know, they support each other, you know, in that sense.
Yeah, no, I couldn't agree more on that one. I mean, this is exactly why we've actually gone out and created within the UK, we've got a state of the PMS report, and the purpose behind that report is to give better understanding of what PMS solutions are out there in the marketplace, but also to then educate around the process of due diligence, because I think that's something that is not really touched upon within the veterinary profession. You know, people are extremely busy. They don't fully understand the technology and they don't know the questions to ask. Therefore, that's where you jump to sort of normally rush decisions, or that's what I've personally seen in the past.
Yeah, it's not just in the veterinary practice, it's everywhere, Jake.
Yeah.
I think there is a level, though, of, you know, you go to these suppliers and you ask, even if you ask the right questions, you are, to some extent, because you don't really understand how a system is built and what's in there, relying on those people to be honest. And I've had 10 years of experience of working with suppliers in the veterinary industry, and I've got to say it's not been a very positive experience, because you only realize after the fact that actually what they've been promising you once you signed up, actually, you know, not all of it is realized, and you're already bound by whatever purchase you've made. So, you know, it's having that support to make sure that what you're also being told is true, because people will sell you things and promise you all kinds of things, and just to get you to sign the dotted line.
Sales process is a very tricky one. Can somebody mute Kenny, please, because it's hilarious.
Yeah, I just did on my end.
What I've seen, Jackie, is that a lot of the time, the reason why the software is not fit for purpose is because instead of using it as an enabler to a process, they're using it as the process itself. So really, you've got to design your process and understand what it is that you want to achieve, and then get the software to help you achieve it. So think of IT as your enabler to the process. So the process comes first. If you do it the other way around, that's when it's not going to meet your expectations. That is my experience.
I think. Sorry.
You have to be prepared for compromise, because no single system will match your process. You have to be a little bit flexible with your process.
But I think I do agree with what Jackie's saying to a point, because especially where right now there's a lot of development going on, there's a lot of improvement, and sometimes there is a bit of a disconnect between, for example, the sales and then the actual product teams, and misunderstanding of the capabilities of the platforms. And I think that can definitely catch people out. And that's no fault of the customer in that example. That is the fault of the supplier that is ultimately promising something that they don't fully yet understand. And that is something that I very much am accustomed to and used to seeing. So I can very much align with Jackie on that front. I think it's a bit of what everyone has said there. I think that all points apply. But I think there are circumstances where, you know, organizations do go out and they do proper due diligence. They do try to understand the products, and they do the absolute utmost they can within reason. You've got to remember that these are busy veterinary practices. They've got lots going on, and they try to implement as much resource as they possibly can to try and make it work. But if you're told something and then suddenly there's a massive gap and there's a massive change, it's difficult to plan and structure. I'm sorry, Jackie, if I'm speaking out of turn, but that's kind of my understanding.
No, you succinctly and very well explained it. Thank you.
No problems. Is that Jackie, the Jackie I know?
Yes.
Hiya, Jackie.
that was a very restrained description when I was talking about it. Yeah, there is definitely a gap between the salespeople. And I apologise if there's anybody here from BT, but BT is a classic example. They send out these really, you know, fluffy salespeople who have no understanding of what they're selling. And you know what you want to achieve, and they just say yes, and then when you get it in, it's like no.
Yeah.
Unfortunately, that's always been the case, though. It's not going. I don't see how that's going to change. As long as you've got commission-based sales, they're going to say whatever they need to get the sale, and then it's somebody else's problem to try and fix. So it'll be an engineer. So in years gone by, PMS would be sold if it was a big sale, significant number of sites. The customer would insist on a piece of functionality being added to the software before they take delivery. So that was driving our development process. Now our backlog was being driven by customers in order to get a sale, which would then put other functionality requests on the back burner. So it's a balancing act. So yeah, tricky.
Daniel's on mute now.
I'm wondering if anyone else who hasn't spoken yet has any thoughts on the conversation or on anything that they've seen throughout the presentation. before I start asking my own questions.
So, for me, I think it's really interesting that a lot of these slides have been a very small animal orientated.
Yeah, sorry,
So,
it's
so
my
that's
primary
okay.
focus.
That's okay. So for me, my veterinary experience has been across the whole spectrum.
Yeah.
And like I said, historically, the first guys to be investing in practice management systems were the farm vets for sending out bills, accurate invoices on a timely manner. And then slowly but surely, small animals started to get computer systems to replace their card systems for booster reminders and the recurring revenue from that area of the business. But personally, for me, I tried to call it machine learning because AI means artificial insemination. And when you're working on an artificial intelligence project, which I've done when we're looking at the cervix to see whether it's good to inseminate or not, it's just AI, and it's like old McDonald's, and you just think, stop, we have to call it machine learning, please. We're talking about machine learning on artificial insemination. So AI to me is artificial insemination. So that's why I would say machine learning a lot of the time. So it's come full circle again, because I'm, with behavior monitoring has been in farm animals for at least 15 years plus. Yeah. With the milking parlors, where you're monitoring the performance of the cow, the yield. You're measuring her lying time, her drinking time, her rumination time. This has all been basic stuff for at least 15 years in the farm world. So again, it's small animal playing catch up, because some of the work I've been doing around using machine learning on the farm side is around insemination, semen sexing for your next genomic layer. So yes, so it's good. It's interesting.
It's a very, very fair comment. And
farm vets are leading the way again.
Yeah, no, absolutely, 100%. And I think it's a shame, because obviously there are fewer of, but obviously they are leading the way, and I suppose it's easier to integrate. What would you say the reasons?
Yeah, they're more open. Well, they're more open to the assistance. It's what we're trying to focus on is assisted diagnosis. We're not making a diagnosis. We are assisting the professional to be more efficient and effective. That's what we've done from day one. It's a bit like when you see the mammograms, where AI can run through thousands and thousands and thousands of mammograms faster than a human can, but you're not expecting it to make any. All it's doing is shortlisting its positives. So a human then goes through the positives to double confirm. It's a double confirmation. And we've been building double confirmation systems for about the last 7 years. So it's
Oh, fair point.
And I'm seeing something in the chat about the same, Fernando saying the same happened with IP terminology when you transfer from an IT related career to pharma. Yeah. But I hope Fernando and everyone else here who's involved on the pharma side of things that you found value in this as well. I don't know how many people from whether it's human health and pharmaceuticals that we have in the audience right now. But I hope you enjoyed the conversation, and I hope that we can continue this conversation in any way possible. So I do encourage you all to reach out to Jack if you want to further that conversation. And I'm going to put his LinkedIn in the chat right now, so that you all can connect with him. Let me put mine in as well. I would love to connect with all of you that I'm not connected with yet, but this is all run off of, mainly LinkedIn. We have on Celeritas, we have our website where we keep these webinars and peer discussions, and that's all at this link I'm going to send right now, which is celeritasdigital.com/webinars. And that's where you can find all of the webinars that we've done in the past and all that we will do in the future. And I'm really thankful that Jack, you decided to come on and put together this amazing presentation for us. It was one of the highlights in our peer discussion history. And so I'm really excited about maybe doing something like this again in the future. But with that being said, we're approaching the top of the hour. And so I just wanted to say thank you, everyone who took time out to join. Thank you, Joanna, for the very nice message in the chat saying thank you all. Great chat. Congrats. Yeah, so let me give you the link to veterinary IT services as well, if you want to learn more about what Jack does. And then I will link you to the Celeritas' website, just so you can take a look at how we are continuing to facilitate conversations like this and create a bridge between technology and animal health. And I hope that you all can be a part of that, whether joining in on discussions like this or just asking some questions and continuing to learn, which is my favorite thing to do. So feel free to reach out if you guys have any other questions, or if you want to present in any months coming up. But with that being said, are there any final words you want to leave everyone with, Jack?
No, just thank you very much for your time, and really interesting to chat to the people that sort of stood up and came forward. So thank you very much for your time, guys.
Yeah, thank you, everyone. All right, and good to see you again, Christina. Thank you for joining. Bye, everyone. Nice to meet you all. Have a good rest of your day.
Enjoy your day. Bye.